Some are calling it that elusive fountain of youth. Could the drug Ozempic, which seems to have been doing wonders to help people, including well-known celebrities, quickly lose weight, be capable of much more? Researchers are now saying that its main ingredient, semaglutide, has even more far-reaching benefits, including treating a wide range of illnesses linked to heart failure, arthritis, Alzheimer's, cancer, and yes, even the battle against aging. The new data has been published in a number of medical journals, and we're joined now by Dr. Michal Koziborod, who was the lead study author of several pieces of research on the effects of semaglutide, and he's a cardiologist at St. Luke's Mid-America Heart Institute in Kansas in the U.S. Thank you very much for joining us, Doctor. First of all, tell us about the findings, what they seem to be telling us.
Well, I think that what we're learning from the studies that were just presented and published in the past 48 hours or so is that we're continuing to learn about benefits of these medications well and above and beyond the original indications that were developed for things like type 2 diabetes and weight management, overweight and obesity. We learned over the past years that medications like semaglutide can reduce the risk of heart conditions like heart attacks and strokes, as well as improving symptoms of debilitating heart ailments like heart failure. What's new in the past 48 hours here at the European Society of Cardiology in London is the studies also demonstrate that more severe complications of the most common type of heart failure may be reduced, things like hospitalizations or visits to the emergency department due to worsening heart failure, and potentially other benefits as well, suggesting lower risk of complications from COVID, for example. So I think the more we learn, the more we understand that the benefits go beyond weight loss, and especially when it comes to heart disease, it certainly appears to be quite promising on a number of fronts.
Well, that's astonishing. It sounds like it's going to solve all the medical problems on people's minds.
Well, I wouldn't go that far. I think we have to stick with what the facts are.
Well, you've listed some of the major ones.
What we know. Yeah, I mean, clearly, there are benefits on a number of heart conditions like heart attacks and strokes and heart failure. There are benefits we know about when it comes to kidney disease. We learned about that earlier this year. And the original indications for which they were developed, like type 2 diabetes and weight management. The medications being studied for a number of additional potential benefits, including in an Alzheimer's disease, but we'll have to wait and see what those results are.
What about the side effects? Are those becoming clear as well?
I think anytime you prescribe a medication, most medications are not for everyone, and similar here, people who take these medications may develop gastrointestinal symptoms like nausea, for example. That's reasonably common. In most cases, it happens early when the medications are started and gets better over time. But some patients can't tolerate them, so it's not for everybody. And there are other precautions in the prescribing labels in different countries that doctors need to follow as well.
Are there, as you know, it was first intended for diabetes, and it was suddenly taken on for weight management, as you called it. Seems to be having a lot of success. Is there a danger going ahead that people will try to use it for things it wasn't intended for? Very briefly. There are people who use medications not for intended purposes. The best thing to do always, as a physician, I can say the best thing to do always is to follow the medical advice of your treating clinician. Yes. And follow the indications that these medications were developed for, because that's what they've been tested the best. Thank you very much, Dr. Michal Koziborod from Kansas City in the U.S.